I think we all agree that this is a meeting we would rather not be having. As I have said repeatedly, I deplore the barbaric and unjustifiable attacks by Hamas on Israel on the 7th of October, which killed more than 1,200 people. I'm appalled by reports of gender-based violence during the attacks and by the mistreatment of hostages. I'm relieved that 114 hostages have now been released, and I repeat my call for the remaining hostages to be released. I well understand the anger, grief, and fear of the Israeli people following the horrific attacks 2 months ago. I also understand the anger, grief, and fear of the people of Gaza who had already suffered through 16 years of blockade and are now enduring the destruction of their families, their homes, their communities, and the life they knew. Dr. Mike Ryan and his team will provide a more detailed presentation on the health situation in Gaza, but it's stating the obvious to say that the impact of the conflict on health is catastrophic. More than 17,000 people are reported to have died in Gaza, including 7,000 children. And we don't know how many are buried under the rubble of their homes. More than 46,000 injuries have been reported. 1.9 million people have been displaced, almost the entire population of the Gaza Strip, and are looking for shelter anywhere they can find it. But nowhere and no one is safe in Gaza. As more and more people move to a smaller and smaller area, overcrowding, combined with the lack of adequate food, water, shelter, and sanitation, are creating the ideal conditions for disease to spread. On average, there is one shower unit for every 700 people and one toilet for every 150 people. There are worrying signals of epidemic diseases, including bloody diarrhea and jaundice, and there have also been reports of high levels of diarrheal diseases and respiratory infections. The risk is expected to worsen with the deteriorating situation and approaching winter conditions. Gaza's health system is on its knees and collapsing. Only 14 hospitals out of the original 36 are even partially functional. 2 north of the Wadi Gaza and 12 in the south. Only 1,400 beds are available out of an original 3,500, while about 2/3 of primary health care centers are non-functional. The 2 major hospitals in southern Gaza are operating at 3 times their bed capacity, running out of supplies and sheltering thousands of displaced people. Meanwhile, more than 180 women give birth in Gaza single every day. There are 2,000 patients on cancer therapy, 350,000 patients with diabetes, heart disease, and hypertension, and at least 20,000 civilians in need of acute psychiatric care, and many more are expected to suffer from severe mental disorders as a result of the conflict. I visited Al-Shifa Hospital in Gaza City 5 years ago, in 2018. I toured the dialysis ward and the neonatal intensive care unit and spoke with health workers and patients. Even then, conditions were extremely difficult for health workers and for patients. Now, the work of the health workers is impossible, and they're directly in the firing line. Since the 7th of October, WHO has verified more than 449 attacks on healthcare in Gaza and the West Bank, and 60 attacks on healthcare in Israel. Healthcare should never be a target. I also grieve the loss of more than 100 of our UN colleagues in Gaza, including our own Dima Al-Hajj, who was killed alongside her 6-month-old son, her husband, and her 2 brothers. In summary, health needs have increased dramatically, and the capacity of the health system has been reduced to 1/3 of what it was. WHO is on the ground in Gaza, alongside our partners, to support health workers who are physically and mentally exhausted and are doing their best in unimaginable conditions. By the way, today I have Rob Holden with us, who just returned from Gaza, our colleague Rob Holden, and our regional director, Dr. Ahmed Al-Mandari, and his team are also with us for any questions you might have. They can give you the first-hand account of the situation. Resupplying these health facilities has become extremely difficult and is deeply compromised by the security situation on the ground and inadequate resupply from outside Gaza. Humanitarian agencies are struggling to cope. The resolution you're discussing today, if adopted, asks me as Director General to do several things: to report on the public health implications of the crisis, to assess the extent of psychiatric morbidity, to strengthen technical and material assistance, and to strengthen our work with partners. But I must be frank with you. These tasks are almost impossible in the current circumstances. Indeed, it's for that reason that the Secretary General last week invoked Article 99 of the United Nations Charter and called for a humanitarian ceasefire. I echo the Secretary General's call, a call I have made repeatedly myself, including during my report to the Security Council 2 weeks ago. A ceasefire is the only way to truly protect and promote the health of the people of Gaza. I deeply regret that the Security Council was unable to adopt a resolution on such a ceasefire last Friday. I know that negotiations on the resolution for this meeting have been difficult, but I very much appreciate the spirit of cooperation and compromise you have demonstrated, and I welcome your commitment to finding consensus. It's only through dialogue, mutual understanding, and finding common ground that we can ever hope to find a resolution to this crisis and to the many other crises in our troubled world. This year is our 75th year as WHO. The opening words of our Constitution remain more relevant than ever, that health is a fundamental human right for all people, and that health is fundamental to peace and security. I urge you to use this moment to fulfill that vision, recognizing as our founders did in 1948, that there is no health without peace and no peace without health. So I hope you will use health as a bridge for peace. Thank you very much. And Chair, back to you.
Thank you very much, Dr. Tedros. Now I'd like to give the floor to the Secretariat to provide a technical update on the health conditions in the occupied Palestinian territory, including East Jerusalem. Secretary, you have the floor.
Thank you, Chair. I'm waiting for slides. Okay, thank you. Good morning, ladies and gentlemen, and let me begin our presentation by also welcoming colleagues. DG has mentioned that we have a regional director for EMRO, Dr. Ahmed Al-Mandari. We also have Rick Brennan, Regional Emergencies Director. We have our special representative to Israel, Michel Therin. Online, we have the Regional Director for Europe, Dr. Hans Kluge, and we have Dr. Rick Peppercorn and his team in oPt on the line, and Dr. Peppercorn is currently in Gaza. We, as a staff of WHO, and as Director General has mentioned, make this presentation in honour of all who've lost their lives in this conflict, and most especially the 133 colleagues in UNRWA who've lost their lives, and our dear colleague and friend Dima Abdul Latif Mohammed Al-Haj, who gave her life on the 21st of November 2023. Dima was the head of the Limb Reconstruction Centre in Gaza. She had been displaced from the north to the south of the Wadi Gaza line and was being hosted in her father's house, a long-standing surgeon in Gaza. And she lost her life with that of her child, her husband, two brothers, and many members of her family and community. We are deeply shocked and saddened by her loss. I'm going to pass to Dr. Teresa Zagaria. Teresa is the incident manager for this crisis at headquarters and the incident management and support team. But the work on the ground is led by our country team, by our country teams, our two regional offices, and we at headquarters are really just pulling together all of the work that they have been doing with you, member states, with partners over the last numbers of weeks. I'm sure there are elements of this that won't be as comprehensive as you like. We will distribute the slides, and if there are other requests for more detailed information, we'll be very happy to prepare further details or slides. Teresa, you have the floor.
Thank you very much, Mike. Excellencies, good morning, good afternoon, and good evening. If you could go to the next slide, please. In the last 60 days, the World Health Organization is monitoring the public health situation in Gaza, in Israel, in the West Bank, and in Lebanon. This technical presentation will outline public health impacts of the escalation of violence with a focus on Gaza, the condition of its health system, and illustrate WHO's operational plan and response measure. Next slide, please. As of 7 December, WHO has recorded over 1,200 fatalities and over 5,000 injuries in Israel. Over 70,000 fatalities and close to 50,000 injuries in Gaza, over 250 fatalities and over 3,000 injuries in the West Bank, and 94 fatalities and close to 400 injuries in Lebanon. Next slide, please. And as of the 6th of December, 134 UN personnel have been killed, and this includes our own colleague, Dima. Next slide, please. In Israel, the majority of the casualties are people who were killed during the 7 October attacks or died from injuries in the aftermath of those. Currently, over 2,000 patients are treated in hospitals for injuries. Next slide, please. In Gaza, the trend of fatalities continue to rise, placing a tremendous burden on the already weakened health system. The largest proportion of fatalities recorded were among children, 45%, and women, 30%. Save the Children, by end of October, reported that the number of children killed in the 3 weeks following 7 of October surpasses annual number of children killed in conflict zones since 2019. From 30 November, there has been a sharp increase in overall daily fatalities. Next slide, please. In the first month of the conflict, 66% of fatalities were reported north of Wadi Gaza and 34% south of the line. It is estimated that more than 100,000 persons are not accessible in northern Gaza. There is no safe place in Gaza. Next slide, please. Over 1.9 million people have been displaced as a direct result of insecurity and evacuation orders. This includes 1.2 million in hosted 159 UNRWA shelters. The overcrowding in shelters, coupled with lack of basic services, has resulted in significant risk to the spread of infectious diseases. Winter is bringing additional risk to health and the urgency of humanitarian assistance. An UNRWA colleague describes the situation as the houses are full, the shelters are full, and the streets are full. Next slide, please. WHO, through its active surveillance system on attacks on healthcare, has recorded and verified a total of 512 attacks since the 7th of October. This has resulted in injuries to patients and healthcare workers, denial of healthcare, and physical destruction of hospitals and ambulances. I'd like to recall here that WHO surveillance systems on attacks on healthcare does not have a mandate to investigate attribution of attacks. Next slide, please. Next slide, please. The health system in Gaza, prior to the 7th of October, had 36 hospitals and 72 primary healthcare units. Currently, only 1/3 of hospitals are partially functional. Of the 24 hospitals north of Wadi Gaza, only 2 are remaining partially functional, so 1 more hospital has lost its functionality. Of the 12 hospitals south of Wadi Gaza, only 3 of those have surgical capacities. Functionality is limited by lack of fuel, supplies, food, and clean water. There are also now 2 field hospitals that are partially functional south of the Wadi Gaza line. An estimated 94,000 liters of fuel per day are needed to cover the most critical hospital functions. And hospital grounds are also now hosting thousands of internally displaced persons. Next slide, please. About 60% of beds have been lost in terms of functionality. Patients and health workers are still reported to be present inside several large hospitals in the north of Wadi Gaza line, despite their inaccessibility. 114 dialysis units are now lost from its function, and more than 1,100 patients are treated in hospitals with very low to no power due to lack of fuel or direct impacts of the conflict. Next slide, please. About 2/3 of the Ministry of Health and UNRWA primary healthcare facilities have been closed, further impacting the access to and availability of urgently needed healthcare. Many of the UNRWA functioning health centers are reporting more than double in the increase of consultations, while working with 60% of its original workforce. Next slide, please. Now into the public health risk analysis from the Gaza Strip. Critical public health risks are driven by inadequate access to healthcare and the living conditions created by the conflict. These include risk to pregnant women and their newborn babies in the absence of healthcare, the ongoing and future risk of those who have been severely injured and their opportunities to live a healthy life. Additionally, the mental health needs are immense. While we do not have the exact figures at the moment, we know from past experience that in situations like this, at least 1 in 5 people will need specialized mental health support. We also know that mental health and psychosocial support is a priority in Israel. Next slide, please. The conditions created by the conflict are increasing the risk of infectious diseases, spreading faster because of lack of water and hygiene, overcrowding, and being more difficult to manage in the absence of adequate health care. We are witnessing high levels of transmission of common respiratory and diarrheal pathogens and increased risk of severe epidemics. Signals of acute jaundice, bloody diarrhea, and meningitis were picked up through syndromic surveillance from the Ministry of Health facilities and UNRWA facilities over the last weeks. And we are working to strengthen the capacity to detect, verify, and respond to epidemics. Next slide, please. WHO has put forward a detailed health response plan for the occupied Palestinian territory, focusing on health services in support of the health system, public health intelligence and disease prevention and control, high-value supplies and health logistics, and coordination of partners. Next slide, please. What we have done to date includes multiple high-risk missions to hospitals across the Gaza Strip to assess conditions as well as deliver critical supplies, support the evacuation of patients from north of Wadi Gaza with the Palestine Red Crescent Society, and coordinate the deployments of emergency medical teams. Next slide, please. As mentioned, WHO is working to strengthen the capacity to detect epidemics and to respond to them. This requires timely communication and a minimum diagnostic capacity, which is currently lacking. WHO is working to strengthen the detection and response function and strengthen the laboratory capacity. Next slide, please. WHO and health partners are providing high-value and specialized medical equipment and essential medicines. Almost $20 million of medical supplies have been procured, are in transit or distributed by WHO and partners to Gaza. WHO has established an online tracking system to ensure coordination and prevent duplication. Next slide, please. As of 7 December, over 3,000 trucks carrying supplies from different agencies have crossed into Gaza through the Rafah border crossing. Of those, 27 trucks carried medical supplies from WHO and other partners. This is not nearly enough. Prior to the 7th of October, 200 trucks a day were not even meeting the needs in Gaza. We needed 500 trucks per day. And even during the pause, only 220 trucks passed for one day. To meet needs, we require more crossing, and we're glad to hear that the Kerem Shalom border crossing may open. Next slide, please. We need for healthcare workers to be protected. The safe passage of medical evacuations and unimpeded access for health cluster partners and emergency medical teams is absolutely paramount to ensure humanitarian health assistance. Next slide, please. The United Nations is appealing for $1.23 billion. For WHO, we have received only 29% of our ask, and health cluster partners even less. WHO released $14.6 million of its internal contingency fund for emergency. We need urgently additional resources to save lives and protect the health system. Next slide, please. In conclusion, the health system in Gaza has been systematically degraded and is collapsing. The public health risks are immense, given the conditions created by the conflict, barriers to accessing health care, challenges in supplying hospitals, and ongoing attacks on health care. The health system in Gaza must be protected, supported, resupplied, and supplemented. People are dying from a lack of access to care and medication, and discontinuation of care. Pregnant women, newborn babies no longer have the services they require, and mental health needs are immense. Access to healthcare through hospitals and primary health centers must be reestablished and expanded. The risk of epidemics is extremely high. Addressing the conditions that facilitate epidemics must be addressed through multi-sectoral humanitarian assistance. In order to save lives in Gaza, WHO and health partners require conditions to work safely and resources to scale up assistance. Protection of healthcare and aid workers and sustained humanitarian assistance are not possible in the current context. With this, I hand the floor back to you, Mike. Thank you.
Thank you very much, Teresa. A pretty stark overview of the situation on the ground right now. There was another photo. There was another slide. Was there? I just want to end with a little note of hope in what, in many ways, looks like a very hopeless situation. This is Dr. Ahmad Dahir in Al-Shifa Hospital in a WHO-led mission, the first mission to Al-Shifa, which rescued a large number of premature babies. And this is Ahmed, who's a clinical specialist caring to the children before their evacuation to the south. Next. And there's Rob Holden, who the DG mentioned yesterday. Rob led that mission with Ahmed into the field, and this is Rob. 28 babies were evacuated to Egypt, and huge thanks to the government of Egypt for accepting and treating these very, very, very sick premature children. All 28 of the children who crossed the border into Egypt have survived. They're all thriving. And it was a poignant moment for our staff to visit and see those children living. I know it's a small drop of hope in a very big ocean of suffering, but at least it shows us that we can do it together, one at a time. N equals 1. It's not 1,000, it's not 1,000,000, it's not 8 billion. 1 matters. On all sides in this conflict, 1 matters. Next slide. And with special thanks to our team on the ground in Gaza, in the middle there you see Dr. Rick Peppercorn. I hope Rick is online and may be able to speak later. On the left is Thanos Gargavanis, and on the right, Hussam Abdouan. There are many, many other staff on the ground from many different agencies. Today we pay tribute to all of the humanitarian actors on the ground, the NGOs, the local, international NGOs, the partners in the health cluster, our colleagues in the UN system, UNRWA, in UNICEF, in UNFPA, WFP, and across the board. Our colleagues in ACHA who provided excellent coordination. Our colleagues in UNDSS who've really done everything to protect the security of our staff. The UN is on the ground. The UN is doing all it can. But in the current context, it is, as the Director General said, almost impossible to continue delivering assistance and most especially scaling up that assistance in the current context of conflict. The space must be created to save life, and we hope that your calls today will create that space. Thank you very much.
Thank you, Dr. Mike. Thank you, Secretary and WHO, for all your efforts. I draw your attention to the draft resolution that will be considered under this item, which is contained in document EBSS/7/conf/1 Rev 1. In the spirit of health as a bridge, in the spirit of humanitarianism, I would like to appeal to all of you. We have seen great efforts to come up with a consensus text. We all know that this text is not perfect. No text is. But let us focus on our ultimate goal, which is to protect the health of all civilians concerned by the situation and move forward with a view for it to be an instrument of health and peace. I will now open the floor for discussion. As agreed, I will now give the floor to Palestine and Israel for a 5-minute statement each. Palestine, you have the floor.